As we age, our immune systems weaken, and as a result, many older adults are at a higher risk of coming down with the flu. Joining us to discuss the importance of flu prevention in adults aged 65 plus is Dr. Adam Welch on behalf of the American Pharmacists Association and Gina Venditti with the Physician Assistant Foundation. Good morning to you both, and thank you for being here today.
Great, thanks for having us.
So Gina, why is it so important for older adults to be protected from the flu?
Well, that's a really great question. I'm glad you asked that. So as we get older, our immune system reduces or decreases in strength. So our ability to fight off an infection is reduced. So an older person can actually be more susceptible to influenza, have more symptoms, and it can last longer. But the other thing to keep in mind is most older people have other comorbidities. They might have diabetes, they might have heart disease, which can be affected by influenza.
What are some of the complications from the flu in adults over 65?
Yep, absolutely. So one of the main complications would be pneumonia. Pneumonia is one of the 8th leading causes of death in Americans. So pneumonia would be one. You can also have some ongoing inflammation in things like your heart, your muscles, your brain.
And what tips and information do PAs give to their patients to help protect them from the flu?
Absolutely. Well, the PA Foundation has partnered with the NP Foundation and the American Pharmacists Association and Securus to really help drive that message about flu prevention. So PAs spend a lot of time educating their patients on the risk factors, the importance of getting the vaccine, and really some of the common sense things that we all might forget.
So Dr. Welch, why should people get a flu vaccine every season?
Well, it's important to get a flu vaccine every season for every person 6 months of age and older. The CDC recommends that as the single best way to help prevent influenza and the complications associated with influenza each season. The virus mutates, it evolves every year, so each year it's important to get vaccinated because the virus might be a little bit different each year. In order to stay protected, we got to get vaccinated.
And speaking of different designs, what makes the flu vaccines designed for older adults different than other flu vaccines?
I think what people don't realize is that there are about a dozen different flu vaccines available on the market, and some of them are particularly formulated for adults 65 years of age and older. One of those vaccines contains an adjuvant, which is an ingredient that helps boost the immune system.
Where can older adults go to get a flu vaccine?
It's important to talk to your healthcare provider, talk to your physician assistant, talk to your pharmacist about which vaccine is appropriate for you as an individual patient. Getting vaccinated is very important. As I mentioned, it's the single best way to help prevent influenza. Alternatively, you could go to vaccinefinder.org.
Thank you both so much. And for more information on this segment, log on to our website, fox4morningblend.com.